Welcome to the Happy Spot podcast on NYC Radio, sponsored by Jack Thomas. I'm just
Does it appear that Gaetano has frozen? Yes. I'm going to step in for a moment. Guy had given me the questions earlier today. So until Guy comes back, nobody can fill Guy's shoes. I am Jack Thomas. I had the blessings of meeting Gaetano Ladiri. He has been working on this movement and connecting people worldwide. Gaetano, he'll come back and share his story, heading up in New Jersey. But today we have the good fortune of Dr. Bruno Rasmussen from Brazil and Dr. Maurice Hinson coming to us from our beloved New York City state. He is originally a Philly kid, so I hope he doesn't get too braggadocious because this is coming out of New York and New Jersey. You know, we all want to make nice here today. So what's really amazing is Gaetano says, "Hey, Jack, I have this idea." And I go into New York City and I listen to a gentleman, and I'm drawing a blank on his name, but he's involved with Kentucky, the Ibogaine movement. And sitting right to my left, without even knowing each other, was Dr. Maurice Hinson. And I had met him, I had seen him speak at an engagement that was in New Jersey. And we at the Happy Spot focus on alternative wellness. And so we're looking at what are the professionals that are sitting in the room and how can we as everyday people make it part of our lives. Some of the things that are out there are Scheduled One drugs. We're not here promoting Scheduled One drugs. We're educating people that there are choices and options, and there are professionals right here in our local market, international market, and we're trying to figure out the best way to serve our people. So with that being said, I do want to introduce the floor first to Dr. Bruno coming from Brazil. Dr. Bruno, who are you? Our podcast, our client, our members out there are 2.6 million people, NYC radio, going around the world. And pretty much this community is about alternative wellness and how we can be better for ourselves personally, humanity. So floor is yours if you just please take a moment and share a little bit about who you are and how we can appreciate you.
Thank you. Good night, and thanks for the opportunity to be here. Well, I'm Bruno Rasmussen. I'm a medical doctor. I work in Brazil. I consider myself the first psychedelic doctor in Brazil. I work with Ibogaine since 1994. And what I'm trying to do here in Brazil is, Ibogaine is legal here in Brazil. Different from the United States, for example, where it's a Schedule One drug. And I'm working to make it more accessible to most of the people here in Brazil that needs it, mainly for the treatment of addiction.
Great, thank you. Thank you so much. And so we can relate to you. So in America, I work with MDs and DOs in their business and advisory business. And so a medical doctor, I'm 58, 59 years old. I'm going to call your traditional, right? They go by lines, right? They look at a very linear path. And your DOs, the osteopath, is looking at a holistic approach. I'm not saying either one is right or wrong. They're just two different approaches. In your practice, how do you look at things so we can relate to you?
Well, I'm a traditional doctor, but I work with a non-traditional medicine. So we work in a hospital. That's the way that we manage to do it legally here in Brazil. So we work with this psychedelic medicine, but in a traditional way. We for sure respect a lot of the traditional knowledge and the traditional cultures, mainly from Africa, where Ibogaine came from. But here in Brazil, because of cultural situation and for the legal situation, we need to try to put this traditional medicine in a medical environment for us to make it more, let's say, for the government and for the health agencies to see it in a more favorable way and help us to do this work.
Great, thank you so much. And I'm going to turn my question over to Dr. Hinson. So Dr. Maurice Hinson, I sit next to you at an event, and you're calm in your stature, and you're sitting there as the everyday person. But today you're here with the medical coat, and you're the doctor. And so your wisdom of who's the story of Dr. Hinson, and why does the community want to know about your practice and your life and how you're serving others?
Yeah, well, I appreciate the invitation. I'm a general internist by training. So I got my bachelor's in neuroscience from Johns Hopkins, and then went on to Drexel to do my medical degree, and then came up to New York to do my residency training at New York Presbyterian Weill Cornell. But I think my story started well before my educational pursuits, right? I think sometimes life guides us in the direction that we should be, and I think we reach a certain point in our evolution where we realize that life doesn't happen to you, it happens for you. And then if you take that approach, then you see how everything that you have to go through, all the challenges, is meant to help you grow and evolve and advance. And I think, and I'm fortunate to have those life experiences that put me on this path, on this trajectory, where now I'm in a space where we can start discussing things like Ibogaine and other psychedelics and other plant medicines that have been restricted, for political and financial reason, but have immense potential to transform how we approach not only mental health, but overall health and wellness. And, my position now, even as an allopathic doctor, is to reintroduce the spiritual elements of medicine. We completely disregard the spiritual self from how we approach health and wellness, which I think is completely inappropriate, and is why our healthcare system and its therapeutics largely fail. Because we're trying to navigate health and wellness without any real spiritual compass. And because of that, our greatest disease is of the spirit. And so my purpose is to really reintroduce the significance of targeting the spiritual self. And that's where the psychedelics really come into play, especially those like Ibogaine, which have such an immense and profound sort of mystical experience, and then associated physiologic changes. And so really my task, my mission is just to spread the word, to teach as many people about this. There's a lot of people don't know that this therapy exists. And so that's one of my many missions.
Dr. Hinson, thank you so much for sharing. And I'm going to now turn my question over to Dr. Rasmussen. Excuse me, I hope my pronunciation may not have been perfect. But the question is kind of a basic question to our audience, right? So here's a perspective. I'm 58, grew up in New York City, live in Jersey, raised my kids 28, 25. And anytime you any 58-year-old having kids, right? My kids don't want to hear from me because they're busy looking at their phone, technology. They know so much more than I do in so many areas, but yet they still look to us for guidance. And one of the questions in here, we're starting off, and Gaetano's coming back. I'm going to ask the first question and then hand the floor back off. Gaetano, it's such powerful information going on here. Even the computer got intimidated by it. The computer got...
Did the gentleman have a chance to introduce themselves? I'm sorry, Larry.
That's okay. Yeah, no, we went through the we set the platform introductions. I'm going off the first question, what you sent me earlier, And so I'm just reading from what is Ibogaine and from what plant is it derived? And so that's to Dr. Bruno. I'm going to duck away, and then Gaetano will take it over from here. Thank you, gentlemen.
Thank you, Larry.
Okay, so ibogaine is an alkaloid that is extracted for many plants, but mainly from the Tabernante iboga plant, which grows in Africa, mainly in Central and Central Africa, and Gabon and Cameroon and other countries around, but more traditionally in Gabon. It's used from a long time there as a ritual. They think that ibogaine turns teens in adults. So at the age of 17, they make a big ritual where people take ibogaine, and after that they are considered as adults and go to the adult work at their tribes. But in 1962, a guy from New York called Howard Lotsof, he experimented ibogaine because he heard that ibogaine had a lot of psychoactive effects, and he had these effects. It's really interesting. The effects are very interesting because you see a lot of images and you see your past life, you see your childhood during this experience. And after that, he noticed it, this Howard Lotsof, he noticed it that he wasn't addicted to heroin anymore. He previously of this treatment, he was addicted to heroin. So he noticed that ibogaine had a role in this cure, let's say. So he started to talk with a lot of people in the United States, a lot of colleges, trying to find someone to make a research there. And it started with him. But now ibogaine, it's known by a lot of people. In some countries, it's banned. It's scheduled, like in the United States, in France, and other countries. But in the most of the countries in the world, it's not regulated. And in Brazil, it's not regulated, but it's not forbidden. And under some rules, you can do treatments here, since these treatments are followed by a doctor, since they are done in a hospital. And it's very interesting because you have no options to treat addiction, and it's a good option. Some research show that ibogaine has more than 70% good results in treating addiction.
Thank you. So, and Dr. Chavez, how does ibogaine work in the brain to actually treat addiction?
Well, there are two kinds of actions of ibogaine in the brain. The first action is raising a hormone who is called GDNF, that promotes connections between the neurons and changes the architecture of the brain, makes some kind of plasticity in the brain. And the other way that it acts, it's by this experience that I mentioned, when you see your past life, and it makes you think about your life, think about your relationships, and this facilitates psychotherapy. Ibogaine is a psychotherapy facilitator. Without therapy, ibogaine has no so much effect. But if you mix ibogaine and therapy, you have this beautiful and good effect.
Okay, so we'll go to a break right now. Then we come back. We'll ask Dr. Chavez about substances and addictions of ibogaine. But we'll go to commercial right now.
Are you a conscious co-creator? Are you on a quest to raise your vibration and your consciousness? I'm Sam Leibowitz, your conscious consultant, and on my show, The Conscious Consultant Hour, Awakening Humanity, we will touch upon all these topics and more. Listen live at our new time on Thursdays at 12 noon Eastern Time. That's The Conscious Consultant Hour, Awakening Humanity, Thursdays 12 noon on talkradio.nyc.
Are you a high-achieving, growth-oriented leader? Are you interested in developing your authentic leadership while creating a healthy, inclusive workplace? Hi, I'm Dr. Mira Brancu, host of The Hard Skills on talkradio.nyc at 5 p.m. Eastern on Tuesdays. where we discuss how leaders develop the hard skills needed to make a greater impact. We interview experts, have live coaching, and tackle these challenges. Listen to The Hard Skills on Tuesday at 5 p.m. Eastern on talkradio.nyc.
You're listening to Talk Radio NYC. Uplift, educate, empower.
Okay, welcome back to Talk Radio NYC. So Dr. Chavez, a question: what substances or addictions has Ibogaine been shown to be most effective in treating? In particular, I have an outside question from a dear friend of mine in regards to specifically smoking cessation.
Yes, okay. Ibogaine works with chemical addictions and non-chemical addictions. For chemical addictions, we can cite opiates like heroin or fentanyl, and cocaine, crack cocaine. Here in Brazil, we use Ibogaine to treat mainly cocaine and crack cocaine addiction because we have a lot of this here. We have not so many opiate addicts like we have in the United States. But it can be used for non-chemical addictions like gambling, sex addiction, food addiction, eating disorders, things like that. And it's interesting because for regular smoking cessation is not so good as you can expect an efficacy around 70 to 80% for opiates, for example. You can expect a result around 50% for the smoking. So it's not the first option. Ibogaine really has the potential to change someone's life, but it's not a miracle. So it's a thing that you must use with other interventions like therapy, as I mentioned before.
Excellent. And
if I could,
Dr. Henson.
add to it, because just to piggyback off what Dr. Rasmussen said, that one of the reasons why it has such a broad efficacy is because it's unlike many of the agents that we have currently, it actually has a myriad of different mechanistic effects. Most of our single agent therapies only have one mechanism of action, but Ibogaine actually targets multiple receptors in the CNS and peripheral nervous system, of which include NMDA, which is similar to ketamine, the sigma, kappa, mu opioid receptors, the nicotinic receptors. It has a significant influence on the serotonergic pathway. And so we can see why we get such an immense response from this single agent, which is very different from a lot of our current standard therapies.
Exactly. Thank you, Dr. Morris. Just to remember, it's exactly why Ibogaine reacts with the opioid connectors, receptors in the brain, that it has its great effect against opiate addiction, although it's not an opiate. It's not it's not an opiate, but it reacts with the receptors in the brain. It's true.
And Dr. Chavez, what are some of the potential risks and side effects of Ibogaine therapy?
Well, the potential risks about Ibogaine therapy are cardiac arrhythmias. Ibogaine sometimes, mainly when it founds some chemicals in the system, like cocaine, for example, it can lead to potential complicated arrhythmias, like especially one that is called torsade de Pons arrhythmia. But this is manageable if you really prepare the patient, if you do it in an environment with all the resources, with doctors, with nurses, in a place that we can make any kind of intervention if needed. For example, I work with Ibogaine for 30 years, as I said. I've seen more than 2,000 patients, and I never saw a complication. But you must prepare very well the patient before taking Ibogaine. Ibogaine is not a thing that you decide today to take it tomorrow. You must prepare yourself, even physically and psychologically.
And medically preparing, so an EKG, echocardiogram, what kinds of exams would you perform on a patient?
Exactly, the EKG and some blood tests to be sure that besides your heart, that is okay, your liver is okay, your kidney is okay. And there are other potential complications on Ibogaine. There are the psychiatric complications. So you can, it's not good to use Ibogaine in a person that has some kind of psychosis, like schizophrenia, some kinds of bipolarity. It must be followed by a multi-professional team to be sure that the patient has the profile to take Ibogaine and that it will be safe for this patient.
And those side effects.
What I've seen in,
yes,
sorry.
Dr. Hensley, go ahead, sir.
At least what I've seen in a lot of the published studies, there's a sort of a pretty extensive screening protocol that a lot of them implement. We know that Ibogaine is metabolized by cytochrome P450 2D6, and one of the objectives in the screening protocols is to eliminate any other concurrent use of medications which are also metabolized by CD6, and that includes a lot of commonly prescribed medications, the SSRIs like fluoxetine, Paxil, and some antipsychotics, even cardiovascular medications like metoprolol and carvedilol. So I think, just like with anything, there's a risk with any medication that we give, any procedure that we perform. It's really about taking the necessary steps to mitigate those risks. And I think by properly screening and doing the EKGs and echoes and eliminating these other medications that are also metabolized by the same 2D6, I think that's when you can significantly reduce the risk. And, funny enough, the objection behind using Ibogaine, at least in the US, is because of this cardiotoxicity and the risk for prolonged QT. But the current standard of care, methadone and Suboxone, they also prolong your QT. As far as I know, methadone accounts for 3,000 to 4,000 deaths annually directly. Suboxone around 1,000 to 2,000. And since Ibogaine has been published over the last several decades, I've only seen documented maybe 40 cases. I don't know how realistic that is, but that pales in comparison to the current standard of care. So yes, we can discuss the risk of this medication, but it seems to be far less risky than the current standard of care.
Yeah. So, and how long would those side effects typically last? And are there any other drug-drug interactions that we should be aware of when treating patients with Ibogaine?
Yes, as Dr. Morris said, a lot of normal usage medications, but the acute effects of Ibogaine, they last for around 48 hours, but you have to be careful about taking other drugs for around a week or 10 days after Ibogaine, because Ibogaine has a metabolite called nor-ibogaine that circulates in the system for a longer time. So it's interesting to be careful. There's an interesting thing about Ibogaine because it seems that Ibogaine resets your tolerance in the brain. So even if you are used to any substance, like caffeine, for example, after Ibogaine, if you take a coffee, it will make a big effect even in the dose that you are used to. So this is a danger of Ibogaine, because if you take Ibogaine and for some reason, even not having cravings, if you decide to take heroin, for example, you can die from your regular dose. You can die from an overdose because your regular dose will turn into an overdose after Ibogaine. So it's a medicine that you must take care about taking it, and you must take care about yourself for some days after it to be sure that you'll be safe. And as Dr. Morris said, there are some deaths related to Ibogaine in the past, but you can see that if you research these situations, you will see that almost all of them, the patients that had problems, they use it, a medicine or even an illicit drug, subreptitiously with Ibogaine. So this is the problem. You can not mix anything with Ibogaine. It's only Ibogaine. Even other psychedelics, you cannot mix. This is the trick to make a safe use of Ibogaine.
Yeah, and Dr. Chavez, you spoke a little bit about this earlier, but maybe you could elaborate a little bit more. What is the role of medical supervision during Ibogaine treatment?
Yes, is to first to give a reassurance to the patient that everything is fine, because it's a very strange experience, and sometimes patients get very anxious with the experience because you start thinking very quickly and you cannot control your thoughts. You start having these visions that may disturb you, mainly if these visions are bringing you memories of your childhood traumas. So one of the roles of the doctor around, or the medical supervision, is to reassure the patient that everything is okay and it will go away, it will pass, you will go to the normal. And other role is to do an intervention if needed, if the patient starts to have some like an arrhythmia, for example, or things like that. You must be there by the side of the bed to act very promptly to avoid further consequences.
Yeah, and you mentioned contraindication. Are there any other contraindications or conditions that make Ibogaine either unsafe for certain individuals?
Yes, like health problems in the liver or in the kidney or in the heart, and psychiatric problems like schizophrenia, psychosis, and things like that. Each patient must be evaluated very individually. There is not a specific rule for this. They must be evaluated, and we must weight the problems and decide if the benefit of Ibogaine will be greater than the risk. So there's not a specific rule for this. You must evaluate every patient individually and take this decision.
Right. And Dr. Hinson, I just want to ask you, in what area of medicine does Ibogaine have the greatest potential?
Well, as I mentioned earlier, I think the greatest deficit that we have in conventional medicine is the fact that we completely disregard the spiritual self from health and wellness. And I think the introduction of Ibogaine and the psychedelics overall allow for the reintroduction of these tools that help us to reconnect and realign. And because when we disregard the spiritual self, then the body becomes sick. And I think we continue to go down the same failed rabbit hole of discovering, these single molecular miracles, and that, it goes against nature. Nothing in nature exists in isolation. And so to believe that we can discover an isolate and it resolves all of our problems, I think is unrealistic. I think Ibogaine, as powerful as it is not a miracle medicine. It's another tool, just like I mentioned this with cannabis. As much as I love cannabis and love the other psychedelics, they're just tools, and once you figure out that you can use these various tools in combination, then we can start to develop far more comprehensive therapeutic regimens for patients. Because as Dr. Bruno said, it's not just the Ibogaine, it's the Ibogaine with the therapy. We're addressing it in a multifaceted fashion, because disease in itself is a complex multitude of interdependent pathologies, or pathologic mechanisms and pathways. And so I think it's irresponsible and unrealistic to think that we can use a single agent or one form of therapy and it resolves all the issues. Now, that's more of a philosophical answer. From a practical standpoint, I do believe it's going to have the greatest impact on the mental in the mental health space, just because this area of medicine has been stagnant for the past several decades, and the medicines that we have available to us are highly ineffective and also carry significant side effect profiles. It was always weird to me to treat someone with a medication that increased the risk for suicidality, and they're already dealing with depression. Like it's no common sense there. So I think the mental health space is in dire need of novel therapies that are actually effective and don't worsen situations. But I also think Ibogaine especially has a much broader use, not just with mood disorders and substance abuse disorders, but also other neurocognitive disorders like dementia, Parkinson's, Alzheimer's. There was a paper that was just published this past week in Frontiers in Immunology where they had a case study where they gave Ibogaine to two individuals with MS, and found a significantly decreased lesion size in one of the patients, and both patients had significant improvements in their, motor function and other issues. And so I think it has an immense potential across the board to really impact a lot of our disease states that we don't have good therapies for. I'll make a prediction and say that I think we're going to see Ibogaine being used in ALS, Lou Gehrig's disease. We don't have any real good therapies for ALS, but just given the neuroregenerative potential of Ibogaine,
Right.
I think that's one disease that I think we could see, significant improvements from with the use of Ibogaine.
Excellent. And when we come back, I'll ask you about where the emerging plant medicine revolution is going with Ibogaine. And I also see a question in YouTube about AFib. I'd like to know about that as well. So we'll go to a break now and we'll come back in a minute.
Hey everybody, it's Tommy D, the nonprofit sector connector, coming at you from my attic. Each week here on talkradio.nyc, I host a program, Philanthropy in Focus. Nonprofits impact us each and every day, and it's my focus to help them amplify their message and tell their story. Listen each week at 10 a.m. Eastern Standard Time until 11 a.m. Eastern Standard Time, right here on talkradio.nyc.
Hi, I'm Linda Marcanico. The A Train to Sedona is a memoir about my journey to love and compassion. It's also the name of my new broadcast on Wednesdays at 12 noon. When we are spiritual, we embrace possibilities and ideas, which strengthen our mind, body, spirit, health, and wisdom. On the A Train to Sedona broadcast, I plan to interview guests who embrace these expansive practices. Join us on Wednesdays at 12 noon on Talk Radio New York City.
You're listening to Talk Radio NYC at www.talkradio.nyc. Now broadcasting 24 hours a day.
Welcome back to Talk Radio NYC. So let me ask Dr. Chavez, have you treated, I see a comment on YouTube, have you treated any patients with AFib with Ibogaine?
Sorry, I didn't.
With AFib? AFib.
Sorry?
Have you treated
AFib?
any?
Oh, no,
Yeah.
no. I never treated anyone with AFib, but I saw the comment, and it's interesting to see that, like this patient is commenting, this person is commenting, it's exactly with Ibogaine. So you must take care. So he stayed in the hospital for 4 days in observation until he's safe. It's exactly what we must do with Ibogaine. Take care of the patient and not do the treatment outside the hospital in a place where there is no resources to do it. So see Ibogaine seriously, take it seriously, take care, as we do with a lot of other medicines. A lot of medicines and medical procedures need to be done in the proper place. Like, for example, you don't do a surgery in a hotel or in your neighbor's garage. You do in a hospital the surgery. So it's the same thing. Until we understand more about Ibogaine and learn how to protect more efficiently people, we must take care with it and take this kind of attention about Ibogaine to avoid problems to people. So it's exactly that. You need to take care. We need to pay attention and not to treat it with like a displicent medicine. We need to really to take care of the patient and only release them when we are sure that everything is fine.
I agree 100%. This should be administered under a medical supervision in a medical facility. Dr. Hinson, where do you think Ibogaine fits within the emerging plant medicine revolution?
I actually see it leading that charge, that when you consider just how powerful of a medicine it is. So just on a spectrum of psychedelics, Ibogaine, as far as I know, has the sort of longest trip, the 48 to 72 hours. And that they found that coincides with what they call the critical period of neurocognitive development. I don't know if you saw that paper that was recently published, but basically that window of neurocognitive development where the brain is most malleable and you're able to learn the most, what occurs naturally, during childhood development and ends like around age 7 to 9, that can reopen what Ibogaine use. And now you can learn new things. And this is what makes it such a powerful therapeutic for substance abuse disorders, because you're relearning, you're literally rewiring the pathologic neural circuitry, which cements those addictive behaviors. And so, given that it has such a powerful and prolonged effect, I think we're going to see, a lot of different before, unresolved pathologies now being addressed. But yeah, I really see it leading a charge when it comes to psychedelic use. And, but again, it's just one of many tools. I don't think Ibogaine is going to be applicable to everyone. I think, you with people who have more mild symptoms, you may not need such an aggressive therapeutic or potentially aggressive therapeutic. I think we're going to get to a point where we can risk stratify patients by disease severity and then implement various different modalities, and perhaps those who have the most, because it appears that the people who have the biggest or the greatest deficits, or who have the most severe substance abuse disorders tend to do the best with Ibogaine. And so perhaps there are other modalities that we can use which don't pose as significant of a cardiotoxic effect that, we can use before Ibogaine. And so, I really see this fitting in perfectly with what we're doing in plant medicine and this revolution of plant medicine, everything from, cannabis to psilocybin, LSD and MDMA and ketamine even. I'm a huge fan of ketamine use in certain medical situations. And so, I'm really excited to see Ibogaine being put in that basket. But, for me, it's really about the plant. Ibogaine is just one of many alkaloids within the plant. And there's even mentioned that the particular plant that grows in Gabon, the Tabernacle africana, I believe it is, that has a different composition, molecular composition than like the Vorkanja, for example, where we derive a lot of the Ibogaine from, or we synthesize a lot of the Ibogaine from. And so I would love for us to get back to the plant. It's something about the plant and all its constituents, not just one isolated compound that really affords the greatest therapeutic benefit. The only time we really talk about that is when we talk about cannabis and the entourage effect, because cannabis has the cannabinoids and terpenes and all these other elements, the flavonoids. But it's not just cannabis, it's all plants that have this myriad of different compounds. And I think we do ourselves an injustice reducing this plant, which has the advantage of millions, if not billions of years of evolutionary perfection. And we think that we can exert its action through one compound. I think that's a misguided attempt to really develop therapies. I think we need to use as much whole plant medicine as possible. And so I would love to see us be able to work with it. And granted, I understand, there's only a small amount of Ibogaine in the plant.
Right.
I think maybe like 4 to 6% or something like that within the plant. But this is why we do extracts, right? To increase the concentration. This is why we have technologies like nanotechnology, right, where we can do a small volume but a high concentration. So I think perhaps rather than focusing on dosage, we focus on different delivery methods.
Okay.
Perhaps that's going to become the new wave of how we approach botanical medicine or whole plant medicine. And so, I'm really excited about where we are. It's an interesting time to be a provider and have access, or at least on the verge of having access
Right.
to using.
We have to first get it out of Schedule 1 and be able to research it properly. That's
Correct.
the issue. And you did mention something earlier in regard. It triggered something, and I thought about it. So you're resetting the brain chemistry, but you need to replace it with a good therapy, right? So the whole therapy piece needs to come into place to replace that. Dr. Chavez, let me ask you, how does Ibogaine compare with other treatments for addiction, such as methadone and norepinephrine? I know you mentioned it a little bit earlier, but maybe you could speak to that a little bit more.
Yes. Well, the difference is that methadone and buprenorphine, they are opioid-like medicines. So they are only substitutes. So you change the opiate that the person is using by a long-lasting opiate that the patient needs to take only once a day, and it really helps to stabilize the patient. So they are oral medicines. They don't have to shoot themselves, and they don't need to use it every hour or every couple of hours. So it's usable. But Ibogaine is totally different. Ibogaine, it's not a substitute, although it reacts with some brain receptors, with some opioid brain receptors, but it's not an opiate. It reacts with other receptors, as we mentioned it, and it really changes the plasticity of your brain, the architecture of your brain, making a new balance of the neurotransmitters and giving the patient a well-being state that lasts for months, sometimes for years, and the patient don't have the need to take any other drugs. So, and it's a very important thing. Ibogaine, you take Ibogaine only once in your life, sometimes twice in your life. You don't need to take it every day. So they are different. They are treatments for the same problem, but methadone and other substitutes, they are only substitutes. Can say you change the substance for that you are addicted for, and Ibogaine promotes healing of the problem, and you can stay away of other medicines if you really are lucky with the results, because it doesn't work for everyone, for a lot of people, but not for everyone. And if you follow the rules, like we said before, and Dr. Morris stressed it, you need therapy, you need a lot of other interventions to maintain this long-lasting Ibogaine effect.
Yeah, and really quickly,
Dr. Henson, yes.
What it appears is the biggest benefit or in the use of Ibogaine is the fact that they're able to resolve these addictive behaviors without risk of withdrawal.
Right.
If you've ever seen someone with an opioid use disorder, the idea of going through withdrawal is what stops them from engaging in some of these other harm reduction therapies like buprenorphine. They do not like buprenorphine, but you're able to achieve a level of resolution without the withdrawal symptoms, which is unprecedented.
Okay, so we're going to go to break, and when we come back, we're going to ask Dr. Chavez about some psychological support. I'd like to know more about in his practice what support is available other than just the drug itself. So we'll go to commercial now and be right back in a minute.
Were you an essential worker during the pandemic? If you needed to learn stages of epilepsy, did you depend on advocates? Did you use new innovations to cope with mental and neurological issues? Maintaining high quality of life and keeping good mental health are what we all strive for. I'm Frank R. Harrison, host of Frank About Health, and each week top healthcare influencers, professionals, and innovators answer these questions and more. Stay tuned on Thursdays at 5 p.m. on talkradio.nyc and I will continue to be frank about health with all of you.
Are you a conscious co-creator? Are you on a quest to raise your vibration and your consciousness? I'm Sam Leibowitz, your conscious consultant, and on my show, The Conscious Consultant Hour, Awakening Humanity, we will touch upon all these topics and more. Listen live at our new time on Thursdays at 12 noon Eastern Time. That's The Conscious Consultant Hour, Awakening Humanity, Thursdays 12 noon on talkradio.nyc.
You're listening to Talk Radio NYC at www.talkradio.nyc. Now broadcasting 24 hours a day.
Okay, welcome back to Talk Radio NYC. Dr. Chavez, I just want to ask you, other than the actual administration of the drug, what other psychological support or therapies do you incorporate into your practice with your patients?
Well, we do two different practice, the pre-treatment psychotherapy and post-treatment. Pre-treatment is more focused in what to expect, and saying to the patient what he could expect to the experience. It's a deep experience. Sometimes it's challenging. So we focus on that, on talking with the patient, learning his problems, trying to understand his traumas, and prepare the patient to what may come during the experience, because sometimes it's very hardcore, the experience.
Yeah.
And during the experience, we stay around, reassuring the patient that everything's okay, that it will go away, it will pass, and nothing bad will happen. But the most important is the post-treatment therapy, where we try to integrate what the experience and the insights that the patient had, because during the experience, during the situation when you can see your past life and you can see your trauma moments in the past, and you will have insights about yourself, about your family, about your relationships. So we try to integrate this in the day-by-day life. So the patient we try to teach the patient how to make a good value of that, how he can use this new learning, this new information to have a better life. And as Dr. Maris said, Ibogaine opens a window of chance or opportunity to learn, to change habits, to act differently that you normally act. So it's important that the patient has this psychological support to go through this phase of a new learning, to try to have a new life and stay away from the problem. It's not only to stop using drugs or substances, but about having a good life, being happy. This is the goal of the patient, to be happy, to live normally without this pressure about I need to use all the time. That's the goal.
And Dr. Chavez, can you give us a breakdown of the legal status of Ibogaine in different countries?
Yes, Ibogaine is forbidden or banned in some countries, like United States, France, Sweden, and others, but not a lot. And the most of the Ibogaine is not totally regulated in any country in the world, but some countries like New Zealand and Brazil have some rules for you to use Ibogaine under a medical prescription. And a lot of countries, mainly in North America, like Mexico and Central America, it's not regulated. So you can use it, but you must work under the radar. It's not, the clinics are a little underground. It's not official. So what we want to do is to totally regulate it in Brazil, to see if you can do or promote a domino effect in other countries in the world, starting by Latin America and after that other countries, for us for the people to have more access to to it, because when a substance is scheduled, strictly scheduled, like Schedule 1 United States, it's difficult even to do research. So we can't learn about it. So it's important that the research happens for us to understand Ibogaine and other substances, other psychedelics. Research is key for everything. So science is key for everything. So we need to do science on these psychedelics to understand better and to make it safer and safer for people in the future use it. And we hope this in Brazil, we hope that it will be a public health policy in Brazil in a few years to help people that need. And it's interesting because all the indications of Ibogaine, like Dr. Morris mentioned it, MS, Alzheimer, Parkinson, addiction, mood disorders, they have not the big medicine that works and that helps. There are all diseases or problems, mental issues that have no treatment. So there is a space for Ibogaine. It's not that we are promoting a new medicine for fever. No, we have paracetamol, we have a lot of things, but no, it's for Ibogaine is for problems that we don't have medicines. So this is the value of Ibogaine. And it may be Ibogaine itself, or it may be new substances divided by Ibogaine, based on Ibogaine, that can help these people.
Excellent. Dr. Hinson, you spoke a little bit about it earlier, but can you elaborate a little bit more? What do you imagine the future of Ibogaine therapy to be?
Yeah, as Dr. Bruno just mentioned, these other areas that we oftentimes just overlook and we sort of dismiss and have no real good therapies for. We're learning more and more that, the root of virtually all chronic disease is inflammation, and Ibogaine is an incredible anti-inflammatory medicine, anti-neuroinflammatory medicine, and so I think it's going to have a profound impact on the prevention and treatment of dementia. I mentioned MS, that study that just came out, having a role in ALS. And what's interesting in that study that just came out with the 2 patients with MS, what they did was they gave the patients a loading dose and then microdose thereafter, 20 milligrams daily. And I do see Ibogaine being used in microdoses for small longitudinal changes. We know that the people where Iboga is indigenous to, they chew on the Iboga plant all day, and it's a stimulant.
The bark, yeah.
It's a stimulant, and so perhaps that has implication on, ADD, ADHD, on energy, on, and when you consider it, virtually every chronic disease state has a psychogenic component. Whether we give, credence to it or not, adherence to medication is a psychogenic, parameter. So perhaps we can really help people who struggle to maintain a certain diet. Maybe this will help. Now, because people have pathologic behaviors associated with eating. This is why obesity is such a problem in the U.S., and so I really think that we're going to see Ibogaine and the psychedelics overall being able to be used outside of this box that we're creating for it in the mental health space. And it's just going to take a little bit of creativity and a little bit of nudging our legislators to change the laws and have it at minimum rescheduled so that we can start studying it appropriately.
Yeah, no, I agree with that 100%. We need to have it rescheduled or descheduled so we can research it properly. There's some fantastic research out there with showing Ibogaine even makes the brain younger. And with this protein unfolding, that once you start understanding the protein unfolding, you can understand Alzheimer's and dementia and Parkinson's and so on. So there's some really fantastic future ahead of us. Any parting thoughts? We have about 3 minutes left. Any parting thoughts, Dr. Chavez?
Oh, I just want to thank you for this opportunity and thank Jack too and Dr. Morris for the company and the great insights, because it's very important for us to talk about this. It's a thing that we said in the beginning. A lot of people doesn't know that it even exists. So it's important to talk about this, to spread the word, and to help people to have more information. At this moment, the more information that people can have is important, because we need to change this situation. We need to really try to reschedule it in the United States, because as the United States being Ibogaine being not a Schedule 1 drug in the United States, all the world will benefit from it, because people follow some of the United States rules in research and things like that. In funding, people are not interested in funding a research with a Schedule 1 substance. So it's important. This kind of promoting science, promoting information is very important. So I thank you all for this opportunity to be here and to talk about Ibogaine.
And I thank you so much. You're a leader in this space. And Dr. Chavez, can just tell us, so where can we get in touch with you? How do we reach you? Can you tell our audience how we reach you?
Yes, well, I have an Instagram account, which is Bruno Rasmussen Chavez. And I have my email, which is brunodrc@terra.com.br. It's the Brazilian address, internet. But you can find me on Instagram at Bruno Rasmussen Chavez with an S in the end.
Thank you. Dr. Hinson, any parting thoughts, sir?
Yeah. Well, first, again, I really appreciate the invitation and opportunity to speak on about Ibogaine. I think my last comments are going to be, for us to really support the movement in whatever capacity. I think everyone has a microphone, even if you're not on a podcast or not in front of a bunch of people. It's just something you can talk about at your dinner table, just to get the information out there, because I think the more people that know about it and the more people that we can have advocate for its use and accessibility and affordability, I think the more we'll be able to get our legislators to change the laws. I mean, personally, I find it criminal, evil, even to restrict and suppress life-saving treatment, because it conflicts with current political and financial interests. There are millions and millions of people who have been impacted, whether directly or indirectly, from the opiate crisis, from mental health disease, from ALS, from dementia, and if we have a therapy which shows potential, then why not make that available to the masses? Why are we continuing to restrict it because we haven't figured out how to tax it, or because the ones who govern the current or the ones who sort of have a monopoly over the industry don't want the competition? At some point we have to put people before profit. I think we've overdone focusing on the dollar and not really leading with moral integrity. And so I think the more people that know about this medicine and that it exists, I think the sooner we'll see changes in its legislation and its accessibility.
And I thank you two gentlemen very, very much for joining me today on Talk Radio NYC. This was a fantastic, outstanding program. Thank you, everyone.
Thank you.
Thank you.